Hey, good morning, everybody, or afternoon now. We're doing a story about top U.S. nonprofit hospitals and CEOs raked up huge pandemic profits, $23 billion in COVID aid from us, the taxpayer. Okay, guys, so let's get into it. OpenTheBooks.com auditors investigated America's healthcare system and found so-called nonprofit hospitals and their CEOs are getting richer while the American people are getting sicker and poorer. So the 20 largest nonprofit hospitals in the country, USA, continued making massive profits while their cumulative net assets soared to $324.3 billion in 2021 from $200.6 billion in 2018. From 200 to 324 billion, 124 billion change. Wow. From 2018 to 2021, the COVID era, the beginning of it even. The year 2021 is the latest year available for cross-comparison purposes. So we don't know what 2022 is yet, but we can only imagine the upward trend. Those hospital systems received congressional COVID bailouts of $23 billion, and only 2 providers partially paid their COVID bailout back. Meanwhile, hospital executives raked up Wall Street-sized compensation packages which frequently exceeded $10 million per year. For example, the CEO at Ascension Healthcare, based in St. Louis, Missouri, made $13 million in 2021 with 3-year pay exceeding $22 million. So 2018, 19, and 20, $22 million profit for that CEO, one person. All this bailout. Furthermore, the American life expectancy during this period sharply declined by a staggering 2.5 years from 2019 through 2022, while comparable country averages rebounded from a COVID-related drop in 2021. The U.S. continued declining in life expectancy. Yet, the cost of health care is still astronomically high, as the average family paid $22,463 in health insurance premiums in 2022. The average family, guys, just over $22,000 and a half. That does not include out-of-pocket costs like co-pays and deductibles, which can be thousands more. This has led to medical debt for about 100 million U.S. Americans. In 2020, the Trump administration issued and the Biden administration finalized in January 2021 a healthcare transparency rule to spur market competition and inform patients. Yet 2 years after the rulebook took effect, an independent audit found that nearly 3/4 of hospitals in the country were not complying, flouting the mandate that prices be posted clearly and comprehensively. So there's a graphic, and on the graphic, it kind of goes over each section from different countries, from different hospital systems. And it shows the COVID aid, for one of them is 500 million. Another is 2.7 billion, like we just mentioned. 3.7 billion, and on and on and on. And then the top executive, wow. This is wild, guys. This is really wild. So let's just go through a couple. This is crazy. Sorry, I can't have it on the screen. That's too much work. So, as an example, Mass General Brigham in Massachusetts got $1.7 billion in aid, and the top executive got $4.1 million with net assets of $9.7 billion. And that's just in 2019, and then in 2018 it goes on and on. Where's the biggest one? Well, here's another. There's many in the billions of COVID aid in the billions. Again, the Ascension one is the top one. There's one called Trinity Health that got $2.3 billion in aid. The CEO, the top executive salary, was $2.9 million. And in 2019, that was 2019 is $13.3 billion. Oh man, and on and on and on. Just insane, guys, insane. So let's get back to the story. I'll throw the screenshot up at the end. Big numbers. So the 20 largest nonprofit hospital systems saw their combined net assets soar 62%, or 124 billion in the 3 years to 2021. You, the taxpayer, funded the rocket ride. Example, the world famous Mayo Clinic, astounding 92% jump to 17.7 billion in 2021 from 9.6 billion in 2018. These companies are just doubling. It's insane. Man, this is another COVID bullshit benefit that we know people aren't really thinking about. These nonprofit hospitals are getting paid, guys. Paid for censorship, paid control. Cleveland Clinic Health System up 60% to 15.6 billion in 2021. Intermountain Healthcare up 63% to 11.6 billion. Tellingly, Colorado Governor Jared Polis had earlier cited Colorado hospitals for nonprofit profiteering. Of course, Northwestern Medicine up 43% to 19.9 billion. Indiana Health Systems up 47% to 10.3 billion from 7 billion in 2018. 3 years, guys, doubling your business. Could you imagine if you have your own personal business that rakes in $200,000 a year and you double, and then COVID hits and now you're 400,000 or more? Or you're a $1 million business and now you're a 2 million, or you're a 1 billion and now you're a 2 billion. No, we go even further. You're an 8 billion company, now you're a 16 billion company. That is insane. Here's the crucial quote. This blatant obfuscation of prices and flouting of the rule demonstrates that implementation and enforcement efforts must be rigorously examined and markedly strengthened to improve compliance, enable technology innovators to parse the pricing data, and empower American consumers with upfront pricing. Patients' Rights Advocate, the PRA, in its February 2023 report. PRA, a nonprofit fighting for system-wide healthcare price transparency, reviewed the websites of 2,000 U.S. hospitals, focusing on the nation's largest health systems. In February 2023, the group found that under 25% were incomplete compliance. In August 2022, PRA found only 16% of hospitals were compliant. Only 16%, guys. Yet only 4 hospitals have been fined by the Centers for Medical and Medicaid, the federal agency responsible for creating and enforcing health and safety guidelines. The CMS fined 2 in June 2022 and 2 more in April of 2023. And then there's the hospital price transparency compliance poster as well. It goes over those ones. So the deeper dive. Here are the financial breakdowns of 10 large nonprofit hospital systems with all or most of their hospitals non-compliant or price transparency. We reached out to each of these hospitals for comments and context. So this will be interesting. Numerous hospital spokespeople point to their absence from the short naughty list. Only 4 hospitals fined as evidence that they are following the law. However, so they're saying we weren't fined, so we're following the law. However, the Department of Health and Human Resource Services Inspector General is investigating CMS for not properly monitoring and enforcing the healthcare price transparency rule. Back to Ascension Healthcare, the biggest one. 2021 net assets were 29.3 billion. 2018 net assets was 23.5 billion. Top paid executive salaries were 13 million. COVID-19 aid received was 2.7 billion. And they have a click to the source. Hospitals in compliance, 4 out of 105 reviewed of Ascension's healthcare, 139 of their Ascension Healthcare's 139 hospitals they have. Percentage compliant, 4%. Wow, guys, this just goes on and on. Ascension spokesperson Nick Ragon said, "We are proud to be a leader in price transparency, not only complying with the rule, but going beyond it to offer consumers tools to estimate costs and provide feedback. CMS itself has indicated that only a small number of hospitals across the country are not in compliance. We will continue to find ways to make sure consumers and patients have the most current information available to make an informed." Yeah, what bullshit, huh? They just keep saying, CMS says we're all in compliance, so, we're compliant, right? And again, CMS is being investigated for their own investigation. And it goes on and on. They go into the Bayfir, Scott, and White Health, net assets. Top paid executive, 4.5 million. They received 1 billion and on and on and on. 9 out of 41 reviewed hospitals in compliance. On and on and on. I'm not going to read all these guys. Look at Kaiser Permanent. 2021 net assets were 52.8 billion, when in 2018 there was 32 billion. That's an increase of 20.6 billion dollars. Top executive paid 6.2 million. On and on and on. Okay, so anything else in this article? Well, guys, that's why. Let's talk about the critics. Frustrated by lax enforcement against hospitals that aren't complying with the rule, New York City Councilwoman Julie Menine, a Democrat representing parts of Manhattan, sponsored a bill in New York City Council to create the Office of Healthcare Accountability. The office would have the authority to publish and compare hospital pricing, audit city expenditures on employee-related healthcare costs, grade hospitals on their compliance with pricing transparency measures, and make recommendations how to lower these costs. Yeah. They called out the New York City's hospitals that are not following the law. In summary, weighty questions jump from these facts. If we are spending more and hospital assets are increasing markedly, why has U.S. life expectancy dropped 2.5 years? Are these nonprofit hospitals operating in the public interest or their private interest? Why don't hospital systems pay back the COVID aid like Kaiser Permanent? Are these nonprofit hospitals gaming the system as public healthcare charities operate under IRS section of the tax 501c3 of the tax code? So they're not paying taxes, right? All profit. Why are systems that score less than 100% compliance of price transparency allowed to keep taxpayer-funded bailout dollars? Compliance is not impossible. Patient rights advocate found 489 hospitals with exemplary files and described as easily accessible, downloadable, machine readable, include all negotiated rates by payer and plan. The federal price transparency rules are clear. 1 of every 4 hospitals follow these rules. They comply with price disclosure. CMS needs to enforce the rules of 3/4 of hospitals that are ignorant of the same rules. Anyways, guys, Irnieracing News, some food for thought, fact for fiction. Cheers.